The global tourism industry is currently grappling with a significant shift in traveller behaviour across South America as reports of hantavirus infections lead to a wave of trip cancellations. This development has placed public health surveillance and the travel sector under intense scrutiny. Hantavirus is a zoonotic viral family, primarily spread by rodents, which can cause diverse clinical syndromes in humans. In the Americas, the primary concern is hantavirus pulmonary syndrome, a severe and sometimes fatal respiratory disease. While the headline of a total end to tourism may reflect localized panic, the underlying public health reality involves a complex interaction between human activity and the natural environment. To understand the current situation, one must look at the specific geography of these concerns, particularly the Andean regions of Argentina and Chile, where the Andes virus, a specific lineage of hantavirus, is endemic. Unlike most other hantavirus strains found globally, the Andes virus has demonstrated the potential for limited person-to-person transmission, which significantly alters the risk profile for travelers and residents alike. This unique characteristic is often a driving factor behind the heightened alarm seen in international travel advisories and the subsequent economic impact on regional tourism. Public health officials emphasize that while the risk to the average traveller remains statistically low, the severity of the disease necessitates a transparent and robust reporting system. The virus is typically carried by specific rodent reservoirs, such as the long-tailed pygmy rice rat in South American contexts. These animals shed the virus in their saliva, urine, and feces. Humans become infected primarily through the inhalation of aerosolized viral particles, which occurs when contaminated nesting materials or waste are disturbed. This mechanism of transmission makes certain activities, such as trekking in dense brush or staying in long-abandoned rural structures, higher-risk endeavours. As news of localised clusters reaches a global audience, the resulting fear has outpaced the actual epidemiological data, leading to the massive cancellations noted in recent reports. Framing this issue requires a balance between acknowledging the legitimate clinical severity of hantavirus and the necessity of data-driven responses over speculative alarmism. For the tourism sector, the challenge lies in implementing and communicating safety protocols that protect visitors without dismantling the regional economy. The current situation serves as a critical case study in how infectious disease dynamics can influence global mobility and the vital importance of early detection and international cooperation in managing zoonotic threats. At the core of the current public health response are the national health ministries and specialised laboratories working to verify suspected cases and track the movement of the virus. In South America, agencies such as the Malbrán Institute in Argentina and the Institute of Public Health in Chile serve as the primary diagnostic hubs, utilising molecular testing methods like polymerase chain reaction, or PCR, to identify viral RNA in patient samples. This laboratory work is essential because the early symptoms of hantavirus, including fever, muscle aches, and fatigue, are virtually indistinguishable from common influenza or other seasonal illnesses. As the travel industry reports a surge in cancellations, health officials are focusing on transparency to counteract misinformation. Official statements from regional health authorities indicate that surveillance has been scaled up in high-risk zones, including increased monitoring of rodent populations to detect shifts in viral prevalence. In terms of logistics and trade, the impact is felt most acutely in the hospitality and outdoor recreation sectors. Tour operators are reporting that international visitors are bypassing traditional hotspots in the Patagonia and Andean regions, citing fears of exposure. However, public health data suggests that many of these cancellations may be based on a misunderstanding of how the virus spreads. While the source material highlights a massive downturn in tourism, it is critical to note that official travel bans are rarely implemented for hantavirus. Instead, health departments typically issue precautionary advisories that emphasize avoidance of specific high-risk behaviors. Contrastingly, the industry claims of an end of tourism suggest a systemic collapse that has yet to be reflected in all official economic datasets, though the localized impact on small communities is undeniable. Hospitals in affected regions have activated specialized protocols, ensuring that intensive care units are equipped with the necessary respiratory support. As there is currently no specific antiviral treatment or vaccine for hantavirus pulmonary syndrome, medical management relies heavily on early intervention and high-quality supportive care. Public health officials are also monitoring shipping and logistics hubs, particularly in rural areas where storage facilities might attract rodent populations. The coordination between laboratory findings and government policy remains the backbone of the response, as agencies attempt to determine if the current spike in concern is due to an actual increase in viral activity or simply heightened media visibility. The tension between the economic needs of the tourism industry and the mandate of public health protection continues to define the official discourse, with a focus on providing accurate, timely information to both the local population and the international community. Prevention and surveillance remain the primary tools for managing hantavirus risk, according to generally accepted public health guidelines. For travellers and residents in South American regions where the virus is present, guidance focuses heavily on minimising contact with rodents and their habitats. Practical measures include sealing gaps in buildings, keeping food in rodent-proof containers, and using traps to manage populations near human dwellings. One of the most critical preventive steps involves the proper cleaning of potentially contaminated areas. Public health agencies advise against sweeping or vacuuming, as these actions can kick viral particles into the air, creating the aerosols that lead to infection. Instead, the use of a 10% bleach solution or similar disinfectants to wet down surfaces before cleaning is recommended to deactivate the virus. For those engaged in outdoor activities like camping or hiking, the advice is to stay on marked trails and avoid sleeping directly on the ground in areas where rodent activity is high. In terms of surveillance, ecological monitoring is vital. Scientists track environmental factors such as masting events, periods of exceptional seed or fruit production, which can lead to explosions in rodent populations and a subsequent increase in human risk. Despite these established protocols, honest limits of knowledge remain. The exact triggers for person-to-person transmission in certain Andes virus strains are still being studied, and the long incubation period of the virus, sometimes lasting up to several weeks, makes it difficult to link an infection to a specific exposure event. Furthermore, while research into vaccines is ongoing, a widely available and effective immunisation remains a goal for the future rather than a current reality. This uncertainty often feeds the public anxiety that leads to the large-scale travel cancellations currently being observed. Moving forward, the goal for public health officials is to move from reactive crisis management to proactive risk communication. By fostering a better understanding of the actual mechanisms of transmission and the effectiveness of simple preventive measures, authorities hope to stabilise both public health and the regional economies that depend on tourism. As the situation evolves, travellers are encouraged to consult official reports from the World Health Organization and national health ministries for the most accurate and current information. The current reporting suggests that while the virus presents a serious clinical challenge, informed caution and robust surveillance are the most effective defences against its spread. For more updates on global health reporting and emerging viral trends, please consider subscribing to this channel. The core of the current public health response is centred on the verification of suspected cases through rigorous laboratory testing and the subsequent data sharing between national health ministries. When a patient presents with symptoms such as high fever, severe muscle aches, and rapid onset respiratory distress, the hallmark of hantavirus pulmonary syndrome, the diagnostic timeline becomes a critical factor for both clinical outcomes and public health reporting. In the regions highlighted by recent travel concerns, such as the Andean corridors of the Southern Cone, national health agencies utilise specialised biosafety level laboratories to process patient samples. The gold standard for detection is the reverse transcription polymerase chain reaction, or RT-PCR, which identifies the presence of viral genetic material in the blood. This molecular testing is often supplemented by enzyme-linked immunosorbent assays, commonly known as ELISA, to detect specific antibodies, specifically IgM, which indicates a recent or active infection, and IgG, which shows past exposure. These laboratories function as the nerve centers for regional surveillance systems, providing the empirical data that either confirms or refutes rumors of a wider outbreak. For the travel and shipping sectors, the implications of these lab results are immediate and profound. As reported in the source material, the fear of infection has led to widespread cancellations of South American itineraries, affecting regional airlines, tour operators, and hospitality providers who are now navigating a landscape of heightened biosecurity concerns. While the source notes a massive downturn in tourism, official statements from travel associations suggest that the impact is most concentrated in rural and ecotourism sectors where the perceived risk of rodent contact is highest. In terms of logistics, shipping companies operating in these zones must also adhere to strict pest control protocols to prevent the unintentional transport of infected rodents or contaminated materials in cargo containers. Within the hospital setting, the medical management of hantavirus remains a significant challenge because there is currently no specific antiviral therapy or vaccine approved for broad use. Instead, medical facilities focus on early transfer to intensive care units and the use of advanced life support, including extracorporeal membrane oxygenation, or ECMO, in the most severe cases to support heart and lung function while the patient's body fights the virus. This high level of required care puts a significant strain on regional healthcare infrastructure, particularly in remote areas favoured by international travellers where specialised equipment may be limited. Public health officials are tasked with bridging the gap between clinical reality and public perception, often issuing clarifications that differentiate between endemic levels of the virus, which are expected in these habitats, and an actual epidemic spike. They emphasise that while hantavirus is a serious threat with a high case fatality rate, its transmission dynamics are specifically tied to the inhalation of aerosols from rodent waste, making it a manageable risk when proper precautions are implemented. The tension between the industry-reported end of tourism and the scientific reality of localised zoonotic risk remains a focal point for government ministries, who must balance regional economic stability with the imperative of protecting both international visitors and local citizens from a potentially fatal pathogen. Current surveillance reports indicate that while case numbers may be within historical norms for certain seasons, the speed at which information travels through social media has amplified the economic fallout, leading to the massive cancellations documented in recent industry reports. Prevention and systematic surveillance remain the most effective tools for mitigating the risk of hantavirus, as public health agencies prioritise education over alarmism to stabilise both community health and the regional tourism economy. At the core of all preventive strategies is the management of the interface between human activity and rodent habitats. Health ministries in the affected regions of South America, as well as international bodies like the Pan-American Health Organization, emphasise a seal trap and clean methodology that is essential for both residents and operators of travel accommodations. This begins with structural exclusion, ensuring that all openings larger than a quarter-inch in lodges, cabins, and storage facilities are sealed with durable materials like steel wool or cork to prevent the entry of the long-tailed pygmy rice rat and other known reservoirs. Beyond physical barriers, the management of food sources and waste is critical. All human and animal food must be stored in rodent-proof containers, and garbage must be disposed of in tightly sealed bins located far from sleeping quarters. For travellers, especially those engaged in trekking or wilderness camping, the practical takeaways are specific. Avoid sleeping on the bare ground, use tents with waterproof floors, and keep campsites clean of food debris. Perhaps the most vital piece of public health guidance concerns the cleaning of potentially infested areas. Because hantavirus is primarily contracted through the inhalation of aerosolized viral particles, standard cleaning methods like sweeping or vacuuming are strictly discouraged, as these actions can loft dried viral matter from rodent urine and feces into the air. Instead, the standard protocol requires wet cleaning, where surfaces are thoroughly sprayed with a disinfectant, ideally a 10% bleach solution, and allowed to soak for at least 5 minutes before being wiped down with paper towels or rags. This process deactivates the virus's lipid envelope, rendering it non-infectious. In terms of long-term surveillance, scientists monitor ecological triggers such as masting events, where an overabundance of seeds or fruits leads to a rapid surge in rodent populations, known as a retarder, by tracking these natural cycles. Health officials can issue early warnings months before a potential spike in human cases occurs. However, public health reporting must also account for significant limits in current knowledge. The incubation period for hantavirus pulmonary syndrome can range from 1 to 8 weeks, making it exceptionally difficult for clinicians to pinpoint the exact moment of exposure, particularly for international travellers who may have visited multiple locations. Furthermore, while the Andes virus strain in South America is unique for its documented, albeit rare, potential for person-to-person transmission, the exact biological mechanisms driving this capability remain a subject of intense genomic research. There is currently no commercially available vaccine or specific antiviral treatment, meaning the global response remains rooted in supportive care and environmental management. The ethical challenge for news reporting and government agencies alike is to provide transparent, data-driven updates that acknowledge the severity of the disease without causing the disproportionate economic damage seen in recent mass travel cancellations. Accurate risk communication ensures that travellers can make informed decisions based on science rather than speculation, fostering a resilient tourism sector that prioritises safety through preparation rather than withdrawal. As the situation in South America continues to be monitored by global health authorities, the focus